Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from Tampa, Florida, and the Moffitt Cancer Center. We were graciously invited to join the CancerX leadership meeting and have several of their leaders joining the show to launch our new Cancer Innovation Series. Many thanks to my good friends, Dr. Kamal Jethwani and Dr. Nainesh Parikh, for the hospitality in making this on-site location series happen. This Cancer Innovation Series was initially derived from a conversation last October at the health conference in Las Vegas, where I became very optimistic about the strides in cancer care, innovation, and patient outcomes. As we were outlining these episodes, it became even more obvious why we need to tell these encouraging stories about innovation, survivorship, and curing cancer. I hope all of you find these episodes as enlightening and encouraging as me, and I expect to host a follow-on series later this spring, so stay tuned. Dr. Parikh, from your perspective, what advancements in cancer innovation are you most encouraged by, and why is it meaningful?
I think I'd break that down into a couple of different buckets. So in the first place, as we all know, screening and prevention, really detecting cancer early is the easiest way to cure it. Mm-hmm. So the ability for digital tools, since we're talking about digital technology.
And curing cancer.
Goes hand in hand with preventing cancer.
Yep.
Screening tools, improving our ability to screen for even things like colorectal cancer. And what I'll say is, through CancerX, I know we'll get there, but seeing the amount of passion and the amount of brain power being dedicated and committed towards screening and prevention is key. So I won't say one technology in particular, but I will say the bucket of people that are committed to improving screening and prevention is incredibly exciting. The second thing I'll say is, this isn't necessarily an advancement, it's just kind of like a curious occurrence. You're seeing this around the world, particularly in our country. People are more engaged about screening and prevention. So, for example, you're seeing a lot of these whole body CT scans, MRIs, things like that. What's curious about it is that no single medical organization has said, we definitely approve it. But no one's come out and said, we don't approve it. And by the way, those companies are doing well, right? They're scanning, they're opening more shops, people are getting them done. What's exciting to me, we're at this inflection point where people are really interested in knowing. And if we focus on cancer, I think the ability to marry the technology that's coming out, the ability to give recommendations to the population that's interested in hearing it, whether it's around nutrition, it's around occupational exposure, it's around environmental exposure, that kind of 100,000-foot view to me is what's most exciting. The last thing I'll say, I think the ability for therapies to be more targeted when you do have an awful diagnosis like metastatic cancers.
Which you're an expert in.
Unfortunately, yes, both personally and professionally.
Yeah.
I think the ability for targeted therapies, so for example, cellular therapy, which Moffitt has been leading the charge in for at least the last decade, has been something that really blew the lid off of how we use immunotherapy to improve outcomes in liquid tumors. Radiopharmaceuticals is exploring that as a type of targeted therapy in solid tumors. I think we're just scratching the surface, and the ability for us to use those advancements with a backbone of digital support, whether that's AI-enabled prediction, AI-enabled clinical trial matching. I mean, It goes on and on. I think those buckets for me are the areas that are the most exciting.
That's very cool. What do you really see? I guess, Dr. Jethwani talked about the passion, certainly with the cohorts and the leadership and the team and the partners with CancerX. But what are you most passionate about when it comes to, obviously, what you work on a daily basis, but also when you see the opportunity to cure cancer or innovations in cancer or even advancements in patient outcomes?
That's a loaded question.
Yeah.
So, little bit related to what we were just talking about, but honestly, what I'm most excited about is the ability to make the journey easier for the patient and their family.
That's awesome.
So when I say easier, again, I think back to my own personal experience. When my mom had cancer, I didn't feel like a physician. I didn't feel like an oncologist. I just felt like a son who was trying to figure out a way for my mom not to suffer, truthfully.
Right.
Never mind live longer, right? And those are two really distinct pieces.
Yep.
as patients and loved ones go through this, we can talk about therapies all we want, and we can talk about data, and we can talk about overall survival, progression-free survival. All these things are great. But what's lost oftentimes is the fact that that patient is still suffering. So what I think is the most impactful, certainly what drives me, maybe I'm taking your question a little bit differently.
No, it's great.
Really what motivates me is the ability to impact that experience, because what's the most heart-wrenching is for a loved one to be suffering, right?
Right, absolutely.
Whether it's a child, it's a parent, it's a brother, it's a sister, it's even an uncle, a nephew, a niece, whatever it is. To see someone you love suffer, especially as a result of the things that they're being given. And then oftentimes, I got to tell you personally, I think to myself, gosh, if I were in that position and I knew that none of this was curative and I was just fighting for an extra day, an extra year, an extra 5 years, how would that feel, right? And then you go out, we're in Florida right now. It's been cold snap down here. It's been maybe 35, 40 degrees. Right. My house isn't built, it's a few leaky windows, right? So it's cold. It's cold at night. Yeah. But then I think to myself, gosh, my mom, when she was receiving chemo, was in the dead of winter. She was already feeling crummy because of the chemo. Yeah. And it was for a diagnosis that really was not going to respond well. How would I feel? So to me, what's really making me most impassioned, again, at the 100,000-foot view, is to say, listen, you've got all these bright people who just want to make one impact, right? If you can improve the patient experience, if you can minimize suffering, never mind improve outcomes. Right. I feel like we're on the precipice of figuring that out.
Right. I love that. No, that hits home for sure. And actually, everything you said hit home, even because I lost my heat a week ago. Right as the cold snap was coming in, my HVAC unit went out. And they can't get out there for a couple more days. So I've been traveling a little bit. Right. I've been home because I have no HVAC.
And it's not meant, it's not meant to say, oh my gosh, it could be much worse. It's just meant to say, listen, when you boil it down to what's important, and that's why all of us feel the same about cancer, right? When you boil it down to the suffering, when you boil it down to, struggling to live, and then questioning that existential question, is it worth it? Which is just an awful question. That's what drives us every day, right?
Well, and also that's why we're here. That's what drove this series. I was so excited when we all met at Health Conference last fall and literally talking about, access to curing cancer, innovations in curing cancer, creating cancer as a chronic condition where we can actually treat it and basically, save lives, increase quality of life, improve quality of life, reduce suffering, all of that. It became, a side passion of mine. We put a whole great series together, and I'm grateful. And it really started with the dialogue with you, you and Kamal. So,
well, thank you for having us. This is, any opportunity to lean in. As you can tell, I'm pretty passionate about it. So, any opportunity.
Well, we're gonna this is gonna be a good year for us in all these regards. So, what are your goals for CancerX, and what do you expect to accomplish in 2026?
Sure. So, as you know, I'm the steering committee chair for the CancerX Accelerator, which is the committed program around accelerating small companies or early stage companies, however you want to define it, to be successful in the digital oncology space, right? Goal for CancerX overall is to mature not only the Accelerator program, but all the other programming that allows us to serve as that digital infrastructure for oncology across the nation, right? Furthermore, the ability to see real impact either through cohort companies or through programming, and see both small companies and major health systems alike contribute to the reduction of cancer. If we can actually see some meaningful moving of the needle, and even in certain areas in 2026, and I know that's not a very specific actionable item, but really all of our efforts coming together. So defining structured data elements, defining how we can actually cobble together sharing of certain amounts of data across systems, right? Creating those ecosystems and collaborations. Never mind seeing one or two accelerator companies come up with commercially viable products. And I'll say this pretty clearly, for me personally, success isn't necessarily about an accelerator company getting acquired. That's great, right? And that's great for shareholders, and I believe in the free markets. Sure. But what matters to me is seeing these products live on and getting patients using the products for their benefit, right? That's why we're doing it. So for me, in 2026, I think at the CancerX at large, starting to lay the groundwork for how we innovate at scale, how we move the needle, and how we really define what we are as the digital infrastructure for oncology care. Right. That's number one. Number two is seeing any of our CancerX Accelerator cohorts, even from 2 years ago, create products that are really getting to the hands of millions of people across the nation. Right. For me, that would be a win.
Yeah, and that's absolutely moving the needle. How many companies are in the cohort today, or how many will be there in this year?
12. So 12 made it in this year. We had 39 finalists, right?
Okay.
And I just want to talk, since you're asking,
Yeah, absolutely.
a little bit
Please.
about the process. You know,
Please.
we've had engagement from so many champions, right? Moffitt's always been there. I'm fortunate to be at Moffitt. Advocate's always been right at our side. But we've had Atlantic Health. We've had Rush that are new entrants into the ecosystem. We've still had participation from Memorial Sloan Kettering and from Dana-Farber. Really, just the list goes on, and it's been incredible to have these folks show up, right? So in the first place, the number of champions that have been participating has continued to go up. The number of total people, I think it was around 60 or 70 people from all of those institutions giving hours and hours of time to evaluate these companies.
Yep.
And we had 39 finalists from which 12 were selected, and very excited about the 12.
I love it. And you do this annually? So in 2027, there'll be another.
Yep.
Will it always be 12 or?
No. So good question. So typically the applications come in the fall, and we've been tweaking the process each year as we learn quite a bit. This year, the process started in September. We had over 100 applicants, which is fantastic.
Yes.
So there's a couple of repeats in there, which is great because I think it improves your chance. I think each year, I mean, these companies are maturing quickly. So over 100 applicants in September. The evaluation and assessment period really happened October, November, and then early December. And then, it's the holidays. So we wait a little bit, and then we announced at JP Morgan the final cohort. What we do is we define themes. We started originally with 3 themes. This year we had 4 themes. I won't bore you with exactly what they are. Suffice it to say, we try to get representation across all 4 themes because we think those themes will drive innovation in oncology. So we always want to have cohort companies represent each theme, and they self-identify as far as the primary themes, for their products and services. Where I'm going with this is we don't necessarily have a cap or a minimum.
Okay.
We want to try to say, listen, if we have companies that are interesting, that fit the criteria, great. What's more important is that not only do those themes get represented, but that the champion organizations that want to work with those companies raise their hand and say, yeah. And this year, what we really go for is having 2 champion companies raise their hand and say, we want to work with those companies. So you can imagine that if we had 20, we would do it. What's really important and vital is the engagement on behalf of each of the champion organizations to raise their hand and say, yeah, we're going to be side by side for this compressed period of 6-7 months. We're going to be there. We're going to be, showing up and giving feedback. We're going to be putting our leaders in front of those organizations and in front of those companies so that those companies have a meaningful experience.
I love it. Well, I'll also tell you, you want to do I'll do a show later on this year. Were you looking for more cohorts or for 2027?
Perfect.
Love to do a show on that.
Yeah.
Let's talk about the programs, the themes, all that kind of stuff. But then also, if there are any shows any companies that you want to highlight that are in the cohort, say, hey, these guys are whatever, the winner or whatever it is, we'll bring them on here. And
okay. No, that'd be fantastic. I appreciate that.
You got it. 9. I appreciate it. We're actually at time, so we're good. But are you going to Vive
Yes,
this year?
I'll be there. I'll be there.
In
We
LA?
have a lot of good CancerX programming.
Yeah.
Very excited. It's going to be fantastic. So you'll be there.
Absolutely.
Are we
I'm a
recording
racer.
again?
Oh, yeah.
Oh.
Absolutely, dude.
All right. Maybe this time Kamal and I will actually have the opportunity to interview you.
Oh, no. That'll be fun. We'd love
Exactly.
it. All right. 9, thank you so much, my friend.
Awesome.
Appreciate you.
Thanks.